So the House of Representatives in Nigeria has commenced plans to amend the Medical and Dental Practitioners Act. It would stop migration of Nigerian-trained practitioners for a few years. Among the changes proposed is that doctors serve in their home country for 5 years before they're given a full practicing license. Let's talk through this further with US-based Nigerian doctor Oyilawal Okwahesui. A very good evening to you, sir. Thank you so much for your time on Newzroom Afrika today. So let me get your thoughts then as a Nigerian working abroad on this bill.
Yeah, thank you for having me. The bill by the House of Rep that have entered the second reading, trying to prevent doctors from going out of the country and placing a ban for 5 years to practice in Nigeria before going out, is inimical to doctors. I'll give various reasons. One, most of the members of the House of Rep and House of Senate have their children going to travel abroad to go for training, schooling. They travel abroad to go for health care. They neglect what is happening in the hospitals based in Nigeria, and do not even try to take treatment for headache. And now you're trying to change an act that tells that after you doing your compulsory 1 year of housemanship, you'll be given your full license. They are trying to stop them from traveling abroad. The essence of brain drain is not about putting primitive measures on doctors. It's, however, the way to try and help and get a brain gain. Brain gain is that you make them go abroad to study, get some more techniques which can help Nigerians in the country. You don't want to punish people when you don't even use the facilities here and prevent them from practicing or going out. Mm-hmm. You can prevent them from going out when you produce what it takes to work in Nigeria here. I'll give examples. In most of the state acts in hospitals here in Nigeria, you don't have functional MRIs, CT scans. You don't have these technologies at all, and you want them to stay and train under you. There should be enacting acts to tell them that there will be more funding for these hospitals. We'll give the best practicing ways to those hospitals where they are able to get equipment at cheaper prices. You're able to help their remunerations. You're able to train them properly so that at least they can meet up with standard international practices anywhere in the world. So bringing the bill to stop them from traveling is a bill against the fundamental human rights of the health practitioners. We are doctors, we're not the only ones that are traveling. Those that are traveling because you don't give them a functional environment on where to stay. You don't have functional security. You don't have functional basic necessities. I have an example of a classmate of mine who has a renal failure now, and he cannot even afford to continue his dialysis.
Right.
These are people that have practiced for more than 15, 20 years in Nigeria. You should try and make them better welfare, so that at least they will want to stay in the country and serve you proper, instead of making inimical bills in trying to prevent them from traveling out.
So what about Dr. Okwahesui, the argument that these are doctors who would have had their training subsidized by the Nigerian taxpayers' dime, and that it would only be fair that for a period of time that very public be able to enjoy services, or basically the fruits of their contribution as per service from these doctors staying in the country for a prescribed period? Is that altogether the wrong argument, or is the issue that it would run for 5 years?
I'm a doctor that I've trained and practiced for more than 15 years. My poor mother helped to train me through school, from secondary school, through universities, before I started my residency in orthopedics. And they can't tell me that it's a subsidized training that I had from the government. Basically, in all spheres, education, engineers, nursing, everybody have the same way we go through in all institutions. And now you're telling me you're subsidizing my training? Why don't you go around and do what is done in those countries that help to help make the doctors, nurses practicing there want to stay? Why are we leaving the country? If you can remember 2 years back when we went on a strike, when I told you that then, I was on this channel and I told you that at least about more than 2,000 doctors have not been paid their remunerations for over 5 to 7 months. Up to now, people are still there that have still not been paid. Are you aware that the health insurance here does not even exist? It's barely nothing, because virtually people are dying every day from COVID, from Lassa fever, doctor having renal failure, and it's not able to access a proper health insurance to want to treat himself. You compare yourself with abroad, where you have good insurance, where at least the government tends to pay some in subsidized rate, which we don't have. The best drugs that we can even get here, as even health practitioners, we're not able to afford it, because we're made to pay like 18,000, 34,000, 40,000 per term for dialysis. These are burning issues that the government needs to look out for. We should look out for why you want them to stay. Are you providing good services for them? Are you giving them package good health insurance? Are you giving them welfare that will make them want to stay in the country to give their best for it? And you bring an argument that you are subsidizing their training. How many of them in the House of Rep and Senate do attend clinics in Nigeria? Basically none. Very few, you say. And now you want to ignite laws to how will I say, to put them in shells and control them, because you feel you have the authority to do that. It's quite shameful. They should make laws that prevent them from going outside to seek healthcare outside and seek healthcare in their countries, or preventing their children from going to attain education outside also, and make it compulsory that all of them attend schools in Nigeria. That should be the way forward. Not bringing bills that helps to capture or prevent doctors from traveling outside to get better training.
Right. And for those of you who have left Nigeria and those who wish to leave, where are people going to mostly? Nigerian doctors, are they going to the United States where you are, and mostly Europe?
Yeah, most doctors are going to Europe and United States. Yes, there are things you have to go to try and train properly also here. Yes, we have one of the best doctors in the world, and doctors from Nigeria and practically Africa have done well in all fields of medicine. So yes, they give you an enabling ground for you to practice. They give you more technologies that will help you be more functional and make people appreciate you better. They give you better welfare packages that helps to make you want to stay at home. They give you better insurances that even when you fall ill, you are at least you are able to access this health care as a doctor even. That is why they are luring people outside. Our country should start making laws that will help us want to stay more in Nigeria.
Okay.
We prepare better health care facilities where you can get the top-notch, good MRIs, good CT scans that can make diagnosis without having problems. Give them good insurance. So at least even when we fall ill later, we know at least we can get insurance that will help take care of part of our training. Give us better packages of trying to subsidize loans for houses, basic necessities. These are ways you try to keep people down in your country and function well, not trying to bring enemical laws that helps to prevent them from traveling outside.
Dr. Oilawal Okwahesui, good to speak to you, a Nigerian doctor currently based in the United States. Thank you for your time, sir.